To reach our ultimate goal of helping doctors provide the highest quality, lowest cost healthcare possible to their patients, it is essential for our participating doctors to benefit also. As you will see here, our plan makes it possible for participating doctors to be among the highest paid doctors nationwide. Your doctors may be the most skilled physicians on earth, but if they are under financial pressure, and/or if they are unable to afford the best ongoing training, state-of-the-art medical equipment, supplies, and the staff they need to do their best, regardless of their desire, they can't reach their potential. Let's consider 3 possibilities that can generously compensate doctors at no cost to their patients. Doctors supporting their patients. Here is one example. Doctors who upgrade to our Doctor Direct comprehensive primary and major medical coverage have, on average, 1,500 current patients. By reducing their patient load to 400 and eliminating the mounds of regulations and paperwork required from patients' health insurance companies, patients could begin receiving the highest quality healthcare that their doctor is capable of providing. Each patient would continue spending the same amount on our plan that they are currently spending on their health insurance. But our new health plan could eventually begin paying participating patients as much as $8,000 a month in retirement income when they retire. By age 95, this $8,000 a month could grow to a total payment of over $2.8 million per patient. This would more than reimburse patients for every dollar they have spent on their healthcare, making our highest quality healthcare effectively free to each participating patient. Participating doctors could be paid an estimated $2.3 million by upgrading their 1,500 patients to our plan. Most DPC doctors seek to care for 400 patients directly. Assuming they are paid $3,000 per direct patient, in this example, we would be paying them $1.2 million. Doctors could then refer their remaining 1,100 patients to a growing number of participating doctors they choose to partner with. Referring doctors could be paid an additional $1.1 million for these referrals, and their team doctors would split $2.2 million for accepting these referrals. Their 1,500 direct and indirect patients could receive $2.8 million each, for a combined income of $4.2 billion paid out to these initial patients, thanks to their doctor. Can it get any better than this? Patients supporting their doctor. As each patient begins to experience that, by simply spending money they are already spending each month more productively, they are enjoying the highest quality healthcare possible from their doctor. And as we explain to them, they realize that their new healthcare plan could eventually begin paying them $8,000 a month in retirement income. This could more than reimburse them for the entire cost of their healthcare, making their healthcare effectively free to them. A major improvement in their lives. So how many of them would be eager to share our highest quality, effectively free healthcare option with others, by simply inviting their guests to watch a 6-minute video introduced to them by their doctor? Doctors could earn $3.6 million in ever-increasing revenue shares from new patients referred by initial patients over the first 14.4 months. Each patient that joins our campaign could be paid as much as $300 per invitation, or $1,000 an hour, as explained in our short overview, simply inspiring others to watch our 6-minute video. If each of these 1,500 initial patients invited just one new patient a month, who then upgraded to our plan initially, that would add 1,500 new patients a month to the patient network being created by our participating doctors. Using the rule of 72 as a guide, by dividing a 10% success ratio into the number 72, in this example, you would double your number of patients every 7.2 months. So if we start in January, by July, the number of new patients would grow to 3,000. And by February of the next year, the number of new patients referred to you directly by your initial patients would have grown to 6,000 new patients. Doctors supporting other doctors, but most DPC doctors say 400 patients is ideal. Once your doctor no longer accepts patients directly, they can begin partnering with other doctors nationwide. In our example, they would still qualify to receive a minimum of $600 times the 6,000 newly referred patients, or $3.6 million in referral fees over the first 14.4 months. And this amount could continue growing year after year indefinitely, and we are just getting started. Doctors supporting their entire community. Participating doctors could also choose to create a community-wide fundraiser producing priceless goodwill throughout the community they serve. Doctors could choose to invite every church, private school, charity, local business owner and resident to participate in our community-wide fundraiser, making their community healthy and wealthy again, and raising millions of dollars for worthy causes all over town without having to ask for donations from anyone. This would also produce a generous revenue share to participating doctors. Here's just one example. A private school could simply invite their staff, teachers, parents, and students to view a 6-minute video about how they can begin receiving the highest quality healthcare, and whose total cost is eventually more than reimbursed to them. The school could raise millions of dollars for their needs. Participating staff and teachers could triple their monthly income. Parents could earn enough to more than cover the cost to educate their children through college, trade school, and/or apprenticeship. And the children could eventually start their careers, graduating with an impressive passive residual income before they earn their first paycheck, and so much more. Looking forward to discussing possibilities with you soon.